Hi everyone, welcome to another episode, or should I say season, or what exactly? But anyways, welcome again to our live session for today. It's Sunday again, and we're here again to talk about your health and all other health related issues. So we're ready to take your questions, your comments, anything at all you have that you want to ask about your health. This platform is a platform for you. And today we're having a guest doctor again, and we're talking about a very juicy topic, and I'm sure everybody will be interested in it. But before I go further, I want you guys to meet me again and again and again, because you're always going to meet me. My name is Mfono Bong. I'm representing First MedTrade on this platform, and this is our usual live sessions that we have every Sunday at 5. So we're here again to talk about our health, and our topic for this week is masturbation. Before I continue to talk about masturbation, let's get to know First MedTrade again. First MedTrade is your one-stop platform to accessible, affordable, and quality healthcare. On First MedTrade, you can find doctors, find hospitals, book for your medical travels, book for your air ambulances, ground ambulances, buy your medical supplies for your hospitals. It's your one-stop place for everything about your healthcare, from hospitals to doctors, with telemedicine, however, anything all that you want to do that has to do with health in particular, this is the platform for you. So do well to log on to our website at www.firstmedtrade.com to get to know more about us. As I said earlier, today we're talking about masturbation and your mental health. I'm sure many people didn't think of it this way, but as a matter of fact, masturbating and your mental health, they kind of have something in common, and that's something we're going to talk about today and get to know more about. And we'll be having our guest doctor, who was our featured doctor for last week, Dr. Tochukwu. His Instagram handle is Dr. TM, the Medical Truth. He'll be the one to take us on this session, and he'll be talking about masturbation and your mental health. He'll be joining us soon to grace this beautiful screen of ours to talk about this thing. But going forward, what are your questions about masturbation? How often do you masturbate? Don't answer that. It's just it's just a question. But what are your fears about masturbation? What do you think about masturbation? You know, a lot of people tend to ask questions like, is masturbation good for your health? Is masturbation, when you masturbate, are you committing a sin? No, people ask questions like, is it safe to masturbate? If I masturbate regularly, is it going to affect my normal sexual life with my partner at home, be it the man or the woman? People also ask questions about how they can actually, people ask as much as trying to see and find out how to masturbate and actually get the pleasure that is involved in this. There are a lot of controversies and things around masturbation, and that is why we're here today to talk about masturbation. But for starters, during the week, we had our weekly post about each topic that we talk about at the end of the week during our live sessions, and we had something that we did about the 5 reasons why people should masturbate, and the 5 reasons why masturbation might not be healthy for you. That was it. So one of them was that sometimes you might feel guilty. You know, masturbating makes you feel guilty at some point, like you did something really bad. And according to our featured doctor of last week, who was a person that actually organized that post for us, he said that if you masturbate and you feel guilty, it may eventually lead to depression. And from depression, chances are that someone that is depressed might likely commit suicide, and which is not a very good thing. Another thing we talked about masturbation during the week was that people that masturbate and tend to use some kind of object to insert into their bodies, especially women that actually use certain object and then they insert it into their body just to, give them the pleasure that they need when masturbating. Chances are that you could actually injure yourself, and you could actually really hurt yourself, and you could actually get an infection, because most of the time those things are not properly sanitized. I mean, they're not even, you didn't even clean it. You just picked up something in your room, on your bed, and then you're inserting inside your body. That is a very unhealthy thing to do, because you could actually hurt yourself, maybe get injured, or probably even get an infection from that thing you inserted inside your body, and it's not a good thing either. I'm sure we've seen on the internet somewhere women that have been rushed to the hospital for doctors to actually take out a particular item they inserted in their body as a result of masturbation. So it doesn't always end well. And for the men, some people are afraid of getting caught while they are masturbating. So there is this tension, or would I not tension, rather, there is this pressure not to get caught. So when they are masturbating, they are looking left, looking right, or something. And let's say in the course of doing that, somebody mistakenly opens the door of the room where you are and catches you. The next thing you feel like, oh, I've been caught. That shock could actually really affect you. It could make you get injured because at that point, you've fallen out of line where you were, and it could actually do a whole lot into your body system because of that little moment between getting caught and not getting caught and actually getting caught at the end of the day. So I think Dr. TM is here, so he's going to be joining us soon. He has already sent in his request, so we're adding Dr. TM now to say more about this. He has better knowledge about this. Okay.
All right.
Hi, Dr. TM.
Hello. How you doing? Good afternoon.
I'm fine. How are you? Good afternoon. I've been waiting for you.
You said what?
Good. I've been waiting for you.
Oh, okay. I've been around. I have been up and about. I've been going up and down. I just decided to take a bath and then come online for the session. I've been going up and down, basically.
Okay, I hope you're settled now.
Yes, I'm settled. How are you doing?
Okay. I'm fine, thank you. My name is Mfonobal from First MedTrade.
Okay. What about Mrs. Lamina, Mrs. Afolabi Lamina?
Amina, yes.
Amina.
Yes, Amina. Miss, actually. She's fine. She's very well. She's not here today, so I'm the one here. So we're going to vibe together.
It's nice to see you.
On this
Welcome.
session.
It's nice to see you.
It's good to see you too. Yeah. Okay, so just for people who are joining us now, this is Dr. Tochukwu. His Instagram handle is Dr. TM the Medical Truth, and he's the one taking us on this juicy topic today: masturbation and your mental health. Actually, he actually did stuff on his Instagram page last week where he did he actually spoke about masturbation at length. So we thought it would be nice to also have him on our platform to talk about this, because this is something that happens every other day. I mean, regularly people are involved in masturbation and they don't know how it's actually impacts on their health. So today we'll be talking about masturbation with Dr. TM. So for starters, can you just expose to us again what masturbation is? Let's pretend that we don't know.
Okay. Masturbation is it's an act of self-stimulation. What that means is that you are stimulating yourself. So I don't know if you can hear me very well.
Yes, you're very clear.
You can hear?
Yes.
Okay. So it's an act of self-stimulation, which ultimately leads to sexual arousal or sexual pleasure, depending on the case. I mean, different people masturbate for different reasons. Some people masturbate to achieve sexual pleasure. Some masturbate to achieve sexual arousal. So, but in whichever case, masturbating, that self-stimulation of the genital organs, eventually leads to either of the two. So everybody has their own reason for masturbating. And now the thing is that masturbation, many people in Nigeria, or let me not even say in Nigeria, all over the world, they feel it's only the guys that masturbate. That's one lie I want to open up. I want to expose. It's not just guy, because everybody, when they hear masturbation, it's a guy. They hear masturbation, it's guys that masturbate. We ladies, we don't masturbate. That's a lie. Masturbation comes across both guys and ladies. In fact, studies have shown now that ladies are even doing more masturbation or are involved in more acts of masturbation than even the guys. So it's equal in both sexes. So don't blame anybody. I hope you're not blaming the guys for masturbating. Ladies are also...
No.
Ladies are also...
Not at all.
Okay. Ladies are also guilty of masturbating. Now, it's a non-penetrative act of sexual intercourse. Nobody is penetrating anything. We know natural sex involves penis into the vagina, but in this case, the penis is self-stimulated or the vagina is also self-stimulated, so there's no penetration. Now, many cultures, westernized cultures, they say that it's okay, it's a normal part of sexual enjoyment. You explore your sexuality when you masturbate. Some people talk like that. Some feel, well, you are less at risk. While I was in medical school, we used to hear that it's okay for you to masturbate because you are less likely to have STDs, sexually transmitted infections, because you are not, there's no act of penetration. So you are just doing it for yourself. So many cultures have said it's okay, there's nothing wrong, it's a safe way of having sex. But I think my recent posts have, I'm sure if people have read my recent posts, you will see that masturbation is not as harmless as we think it is. It's very, very, very harmful if you really do not take certain precautions into consideration. Masturbation, we even in the clinics that we work as doctors, we tell men before they can produce a semen analysis or semen MCS. Of course, we cannot withdraw sperm from their body now. We cannot withdraw it like blood. Eventually, they have to produce that semen somehow, and the only way they can produce it is through masturbating. So even though, yes, we tell them to masturbate, but it's not something we encourage them to do every day. I don't know if you hear what I'm saying, ma.
Yes, doctor.
It's not something we encourage them to do every day. You do it only once, and we don't do semen analysis every day. We don't do it every month. This is something we do. It's not a routine test. It's something we do once in a while to check how fertile, how capable a man is. So it's not something you do every day and then you now get some sort of pleasure from doing it every day. Another thing I wanted to, oh, sorry, can I go on?
Yes, I'm listening. Yes.
Okay. So another thing I wanted to say is that masturbation, the fact that it's pleasurable, you know, and like I had a patient I was talking with, he was saying that he doesn't want to go through that stress of toasting a lady. You know, what a regular guy likes to do now these days is that they see a lady they like, they collect her number, they chat her up, they send text messages to her. Eventually, what are they looking for? They're looking for sex. So some men now feel that that is a long process to go through. I mean, you have to buy the lady breakfast, you have to buy the lady lunch, you have to buy the lady dinner, you have to buy her clothes, you have to impress
Not
her.
all the
It's
time.
a long journey. Eh? It's a long journey.
It's not all the time.
It's not all the
But
time.
it's not all the
Someone
time.
like
No.
you know, there are some ladies that are hard to get. Like someone of your type of person, you cannot just buy 15 naira granuts and you will agree. You have to go all the way to impress. So some guys are tired of all that. They are tired of going all the way. So there's, sorry, I didn't get that.
I think it's not everybody.
It's not everybody. I'm just joking.
Yeah, definitely. There are people that, it's quite easy. They just talk and the next end up together.
Okay. So I'm just joking. I know it's not everybody, but these are the words. These are what this guy was saying. This particular patient of mine, what he was saying in particular. He was saying he doesn't want to go through that long process of toasting or wooing a lady. So he just went into masturbation. A friend of his, introduced masturbation to him, and then he actually started with that. And he found out that that is so much easier for him because he's all by himself. He satisfies his sexual pleasure without having to call a lady up and like that. And presently now, he's no longer interested in having normal, intimate sex with any other lady again.
Oh, wow.
Well, do you understand? So it's something he has become used to, or the masturbation has gone under his skin, that he's so used to it, and he no longer sees actual sexual intercourse as really important. What's the point? I can do it by myself. I don't need anybody to help me to do it. I don't know if you understand what I'm saying. Hello?
Yeah, I do. Yes, I do. I get you.
So these are the dangers. But I don't want to go into it. Let me allow you to ask the questions.
Okay, so you said back then when you were in medical school, it was said that masturbation is healthy. Well, yes, because even if you go through the internet now, you find out that a lot of masturbate, and there is little to no adverse effect, health effect of masturbation. And then yes, it's a myth that masturbation is common among men. It's a myth, but then from what we know, prior to um, this generation or this generation that had access to everything and then explore everything, it was only masturbation was more common among guys. I'm sure that's where the generalization came from. But then I agree with you again that both sexes actually masturbate. So both sexes. Somebody asked a question. Sorry, I have to start with this one because, well, I want to know. Someone asked, if you masturbate, will you lose your virginity? That was a question somebody asked. For
Okay. I'm guessing that person is a lady. Am I
well,
right? Is a lady. Okay.
the
But
person wants to know. Yes.
okay, possibly. No, a guy can actually ask that question. A guy can ask that question. What does losing virginity mean? Losing virginity means when you have sex for the first time, there is penetration. Like I said earlier, masturbation is a non-penetrative sexual activity. You're having sex, it's actually a sexual activity, but there's no penetration. Nobody is penetrating anyone. But losing a virginity, or somebody saying, I have lost my virginity, you have had sex, penetrative sex. So you cannot say a person who masturbates has lost his virginity because you have not actually had sexual intercourse. For a guy, all it just means is self-stimulation and you reach climax. The whole thing about masturbation is that there's self-stimulation. And for a guy, obviously, the answer to that question is no, because you are not penetrating anyone. You're just stimulating and then achieving sexual arousal or sexual pleasure. But for ladies, losing virginity is still a penetrative sexual intercourse. And losing virginity, it depends. Like I think somebody pointed out, what about dildos? In
Yes.
certain
Yes.
exactly, inserting phallus-like objects into the vagina. Uh, it depends. I can't really say if it is you have lost your virginity or not. It depends. Like I said in the beginning, that many people have sexual intercourse masturbate for different reasons. They masturbate for sexual arousal, some masturbate for sexual pleasure. So it depends, really. I can't really able to say if a woman can lose her virginity. I've answered for a guy. A guy can definitely not lose his virginity by masturbating. But a lady who uses
Okay.
dildos, yeah, a guy, I've answered for a guy. But a lady who uses dildos, it actually depends on why or what was the, will I say, benefits, or why was she engaging in that particular sexual activity. If you are using a
Okay.
dildo, if you are using a dildo and while using the dildo your hymen breaks, if you're having that particular experience for the first time, you see a drop of blood, obviously you have lost your virginity. There's nobody that needs to tell you that. You have used it and you've used it well enough that it actually looks like a sexual activity. Your hymen has broken, and that means, what it means is that you have lost your virginity to a dildo. And that's really, really it's a very, very sad thing to say. Because
It's time to give opportunity to a dildo.
it's very, very, because I'm like, you are losing your virginity to a dildo. So it depends on what that lady in particular is using the dildo to do. Is she achieving sexual pleasure or is she achieving sexual arousal? So if she has achieved sexual pleasure and her hymen breaks, then she has lost her virginity. I'm sorry about that. But for a guy, you're not penetrating anything, so there's no loss of virginity.
Okay, so I mean, it just stayed back in my head, losing your virginity to a dildo. Well, different people, different strokes for different folks. I mean, people have reasons why they do they do. So another question somebody asked was, in recent times, like the last few years, we've had so many sex toys. I mean, the dildos, the what they call it, the vibrators, and all that to stimulate themselves. Somebody asked actually, and what are the side effects of using some of these sex toys to masturbate? You all actually want to have a normal sexual life, apart from the fact that you take some time off to stimulate yourself, you still have a partner, a sexual partner. How far does these things health affect your health in general and your normal sexual life with your partner?
Okay. I'm going to repeat the question you said. I think what you said, I didn't really
Hello,
hear
Dr.
very well.
TM.
I think you said what impact. Hello, hello. What impact does masturbation have between you and your
Okay, you didn't hear me.
network?
Okay, I think the network is a bit faulty, but can you hear me now?
All right. Hello.
Yes, can you hear
Hello.
me now?
I can hear you.
Yeah. Okay,
Okay,
so
I
I
can
was
hear you. Can you
asking that.
repeat the question?
Yes, please. That's what I want to do now. Okay, someone asked, what are the effects of using some of these sex toys to masturbate for both the man and the woman? Some men penetrate their anuses with dildos. Women use dildos, use vibrators, the ones that they have to plug to electricity, the ones that actually supply the power. Power is supplied to the dildo via batteries or anything. So the question is, what are the effects of using sex toys to masturbate, and how does this affect your normal sexual life with your partner? If you have a partner that you're actually having sex with and you're also masturbating, how does masturbating with sex toys affect your sexual life with your partner and your health in general?
Okay. All right. Okay. So the question is, women who use these dildos or use certain objects to penetrate themselves. You are when you do it the first time, you enjoy it. The second time, you enjoy it again. The third time, you continue to enjoy that particular process of using dildos. You now find out that when you're actually with a man or a male person, you find out that dildo seems to be doing more better than what a man would do. I don't even understand what I'm saying. The woman in question, the
Yeah.
woman who is masturbating, now has more faith or more, will I say, more confidence in the dildos than an actual person who has blood running through his veins. It has an impact because it now seems like you want more in that sexual relationship. You are not satisfied. You become this type of person who is crazy, who is awkwardly crazy in sexual relationships, such that you want what a dildo is supposed to do. A dildo you can manipulate. You can manipulate a dildo, but you may not necessarily manipulate a guy or a man. So that problem of manipulation can be a challenge because this particular woman wants more than what the dildo is giving to her. You have started with something sweet. You want something sweeter. So when a guy comes and gives you something sweet or averagely sweet, you are not satisfied. And it becomes a problem in that relationship because what happens, you start, there are fights, there are issues in the relationship. Lady is not getting satisfied, husband is getting frustrated, he goes up and down getting pills to satisfy. He just can't do enough to satisfy that lady. Why? Because this lady has been used to dildos, has been used to foreign objects that she can manipulate by herself, that may not be easy for her to now manipulate a guy who has blood running through his veins. For a guy, I've already mentioned it already. You have been dating as a child, say from 10 years old or 9 years old, and you've been masturbating, you masturbate in your room, you lock the door, you don't want your parents to come in or your siblings to come in. You've been doing it for years. You have now associated sexual intercourse to like you're about to steal or you're about to commit armed robbery, like a particular act that nobody should see. Do you understand? This is something that has gone into your psychology. And so when you now actually want to have sex, now, you find out that you are still having these anxiety issues. I have a patient that I want to talk to you about. He's having premature ejaculation presently now. Why is he having premature ejaculation? He has been masturbating for many, many years, since he was 11 years. And ever since he has been masturbating, he has been hiding. Nobody actually found out that he has been masturbating. So as he has been masturbating all along for many, many years, he now finds out that whenever he wants to have sex with his girlfriend, he's always checking the door. He's always checking the door. The door is locked though. There's nothing wrong with the door. Checking the door when he's about to have his wife, not even girlfriend, I forgot, with his wife. And it's not like anybody is in the house. He just keeps checking the door. Why? Because that psychology has gone inside him that when you're about to have sex, always check the door. So that anxiety now makes him rush through the sexual intercourse, and that now leaves his female partner unsatisfied because he has been used to that activity of hiding or rushing or checking the door. Is anybody coming? Is anybody this thing? And now, because of that, he even developed hypertension. Because of it, he now has hypertension because of what? Wow. Masturbation. You can see, this is something, you can see it's like a cycle. It goes round and round. You have been masturbating for many, many years. You now have this anxiety, unnecessary anxiety, that seems very uncontrollable because this is something you have been doing for a very, very long time. And before you know it, you are now having symptoms. There are certain hormones that come out in the body when you are undergoing stress. We call them catecholamines. They come out in the body when you are stressed out. Your heart rate starts going up. Your respiratory rate starts going up. You start breathing faster than usual, like you're having a panic attack. Your blood pressure goes up, your sugar goes up. Those are the things that happen when he's about to have sex, which is not supposed to be so, really. So now he has developed hypertension because of masturbation. So it's a cycle. Wow. Those are, I'm more conversant with the effects of masturbation on a man than a lady because, well, I've not really had female patients who have told me that they are masturbating. I've not seen any, but it's common, but I've not seen any. But most of the guys that I interact with, they have some associated anxiety issues around their masturbation, and it's affecting them in many ways than usual.
Okay. Just before I ask my own question, going through the comment here, first of all, one of our audiences here, Dr. Health and Mo, asked the question about the effect of masturbation on guys, like for guys that use sex toys on themselves to pleasure themselves, like guys that use dildos to insert in their anus. That is one. What is the effect of that? Then a second question came from, I think, Afro Amina in the comment section there. She also asked, what is the relationship between masturbation and one's mental health? Obviously, I think she's just keying into our main topic for today. So let's talk about those two.
Okay. So Dr. Heldenmore said, what's the effect of a guy who uses dildos, right?
Yeah, for men.
Am I right? Yes. Men in the anus.
Yes, for men.
It's still the same thing. Yes, it's still the same thing as I said for ladies. It's still the same, will I say, the same impact that affects them that would also affect a lady or a guy. You are inserting objects into your genitals, either the anus or the vagina in females. What can happen? We're talking about, are you saying the impact as relates to the particular, the spouse, or the health implications? I don't understand the question.
The health implication. And yes, and how it affects sexual life with his partner.
You're inserting things into the anus or the vagina. There's always risk of trauma. There's always risk of something getting injured in the process. I mean, the anus is a very delicate part of the body, delicate part. It has delicate vessels, delicate blood vessels. So you notice that anything that goes in there, there will always be some form of bleeding. So if you put an object that is bigger than usual, and usually that anus, it has a sphincter. It has a sphincter that closes and opens up. It closes and opens up. So when you put an object that is not supposed to be in there, especially a bigger object than necessary, stimulating the sphincter, that property of the sphincter that helps to close up and open up, close up, that rubber-like movement that helps to close up and will be lost. So what can happen? You find out that you cannot control bowel movement. What that means is that you are defecating on yourself, because it is that sphincter, they call it a sphincter, the anal sphincter, that controls passing out stool and keeping stool in. I mean, when you are about to go to the restroom, you find out that you are able to hold yourself before going to the restroom. Why? Because of that anal sphincter. So you can be able to control when and how you defecate. But for a guy or a lady who has been putting certain objects into that place gets wider and wider, it stretches out, the anal sphincter is lost, and before you know it, you now find out that that person has lost bowel control. That's one. Let's not forget infections. I mean, some of these objects that they insert, they are not clean. Some people will just get anything they feel like using. Anything. I mean anything. They just get anything and insert directly into a particular part of the body. We're talking about infections, will I say rashes, vulvar infections, vaginal infections, anal problems, anal issues that would result from masturbating, especially when you do it on a regular basis. Then, okay, was there anything mentioned? Okay.
Yeah, and then the relationship between masturbation. The relationship between masturbation and mental health.
Okay, mental health. Okay, most of these things I've said them. This thing they call mental health is all I'm about. I preach against mental health. I mean, if one is masturbating and nobody knows, and you are coping with it, and you are able to keep it within yourself, it's not causing you any distress, it's not causing you any problems. What can happen? I'm not offended by that, or I mean that is a part of you, that's your life. If you are masturbating and you are coping with it and nobody knows about it, I mean, I have no business telling you what to do. But the moment that masturbation is causing you a lot of distress, a lot of problems, such that you now start becoming guilty. You are not guilty before, you were very confident, you had self-esteem, you were doing well by yourself, but you now notice that after masturbating, for each episode that you masturbate, you find out that you have this sense of guilt within you, like you have done something bad. I think I heard you saying something like that. You have this sense of guilt within you. And when you are guilty the first day, guilty the second day, it happens for a whole 1 year. Before you know it, you start getting depressed. And gradually you're at risk of committing suicide. That is distressing. And that is where I have an issue. Because of Nigeria, we know how Nigeria is. Even abroad, there's still some stigma, maybe just a slight stigma associated with masturbation abroad. But a large number of people believe it's okay to masturbate. But even at that, we still have a small percentage that feel that masturbation is not good at all. Talk less of Nigeria. I mean, Nigeria, you're going to the pharmacy, your chemist shop to buy condom, ordinary condom, as simple as condom. Anybody can buy condom. You might buy condom to have sex with your wife so that she does not have more than 10 babies. It's okay. There's nothing wrong in doing that. You're trying to prevent unwanted pregnancies. It's okay.
Yes.
But the moment you go to a chemist shop and you are buying condom, the way Nigerians will look at you like you have killed somebody and they want to burn you like a witch or a wizard. So these are the problems we have in Nigeria. Nigeria is a tough country. We stigmatize a lot. And so that stigma
claims to be righteous around here.
Sorry, I didn't
I
get
mean,
that.
everybody claims to be righteous in Nigeria.
Sorry?
I said everybody in Nigeria claims to be righteous.
Exactly. They are judgmental. They feel that they are better. Everybody wants to be better than you or better than another person. So you're seeing a young guy or even a middle-aged guy buying condom at the pharmacy. You're thinking that he's a sinner, he's a fornicator, he's a womanizer, he's a bad person, he's a bad blood, without knowing his reasons for actually buying the condom in the first place. That is Nigeria. That is the country we are in. So the stigmatization already has an effect on us. That stigmatization has an effect on us. For someone like me now, if I want to do anything, I have to think about, like, I don't know if it was you I was talking to. I think I was talking to you or maybe Miss Amina about the topic in particular. At first, I was skeptical about choosing this topic. Why? Because I didn't want to
Yes.
offend anybody. Because this is Nigeria. I don't want a situation where I'm saying masturbation and then they're saying, this doctor, is he okay? Is he that? Do you understand? So I was skeptical about it. But Nigeria, Nigeria is a country where if you're not very, very careful, if you keep putting what other Nigerians about you, about your personality, you will find out that you will get depressed and kill yourself. And by the time you have killed yourself, these same Nigerians will say, is it not that small thing? And that small thing will happen where he go kill himself. I don't even understand what I'm saying. So this is the problem
Yes, I
in
get
Nigeria.
that.
Like Nigeria, we have issues, so many issues, that things that we need not worry about, things that we need not judge or need not stigmatize, we stigmatize. Even this COVID-19 now that is going up and down, we are stigmatizing COVID-19. So you can see this is a country where you do not want to masturbate. You don't even want to try it because the guilt
You see, don't.
can leave you very, very depressed. And when you are depressed, in fact, when you are severely depressed, you are at risk of committing suicide. And I am somebody who doesn't want anybody to commit suicide. I don't want anyone to try to commit suicide, especially in Nigeria. There should be no reason why you should do that. Now, the second reason is addiction. Of course, like I said, it's a pleasurable act. You do it the first time, you do it the second time, the third time, it becomes a part of you. It's a sweet feeling, it's not stressful. I mentioned that patient I had that said he would rather boycott all that long journey of toasting a lady, wooing her, buying her clothes, buying her, now, just
Taking her for
seducing
days.
her, basically. Boycott all that long journey, and before he now gets to the bedroom. So he said he doesn't want to go through all that. He would just rather masturbate on his bed and get that sexual satisfaction that he would have gotten if he had had sex with a lady. So you can see he does that the first time. Before you know, he gets addicted to it. It's so easy to masturbate. That's just the truth. It's very, very easy to masturbate. People who masturbate sometimes, nobody teaches them how to masturbate. They just do it by themselves. Learned behavior. Hello, in psychology, there's something we call learned behavior. It's a type of learning. Can you hear me very well? Hello?
Yes, I can.
Yeah.
Yes, I'm
It's a
here.
type of learning behavior where you do something and it's pleasurable. You tend to do that thing over and over again, especially when it's an easy thing to do. So the addiction is there, and I still have patients who I'm trying to help with their addiction problems, who, because of masturbation, have interest in their family. I mean, there was a guy who told me that his mom was in the hospital. His mom was critically ill. And because of masturbation, because he needed to masturbate at that particular point in time, he couldn't visit his mom in the hospital. You can see.
Oh,
That is
okay.
somebody who has gone deep into masturbation, such that his mother means nothing to him any longer, because he just wants to get that sexual pleasure from masturbating. How bad masturbation can be. You don't have any interest in your family, you don't have any interest in your friends don't mean anything to you any longer. In school, your grades are dropping. At work, your productivity is getting poor. You're no longer putting your very best at work. I mean, during a business meeting, you are going, if you feel like masturbating, you leave the business meeting and go to the
Run
restroom
to
to
the toilet.
masturbate. Something important, you understand, something important that may have been discussed in that business meeting, you will not be able to pay attention to it because you want to go and masturbate. What about relationships? I mean, you're no longer interested in having a stable relationship with a lady or a guy because we are masturbating. These are the harmful
Yes.
effects of masturbation. And I think that is the greatest masturbation can have on one's mental health. Because addiction to masturbation or addiction to pornography, mind you, pornography and masturbation, they go hand in hand. Some people, some patients I have, they masturbate on their own. They don't need to watch pornography to masturbate. Some, they need to watch pornography. They need to have that phone in their hands before they can be able to masturbate.
Yes.
So those type of patients I have, it's very easy for me to treat or help them with their addiction. What I just need to do, what I had with a particular patient, I'm sorry, I hope I'm not digressing too much. Am I digressing too much?
No.
Okay. No,
Not too much. Have network issues. Dr. Tim will join us again right now. We're going to connect to him again soon. I'm sending him a message. And just before the network actually put that stunt on us, he was talking about masturbation going hand in hand with pornography. And yes, it's true. Research has shown that a lot of people who get to masturbate every now and then usually use pornography to masturbate. I'm still trying to connect to Dr. TM now. We're waiting for Dr. TM. We're trying to connect to him again. Okay. I'm not sure exactly what it is, but it seems to be difficult to connect to Dr. TM right now, but I'm hoping he's going to join us soon. So back to that, I have one more question for Dr. TM before this live session is over. So I'll just throw it to the audiences here. I mean, there are doctors also viewing this particular live session. So people have said that the reason why people feel comfortable masturbating, you know, they've come across this particular research that has said that masturbation reduces lowers the risk of, the guys are using this as an excuse to dignify masturbation, or to dignify the fact that they okay, we're back again. I'm so sorry, guys. The network is pretty bad, and I don't understand why it has to be now. Okay, so I was saying that some guys have used takes of okay, Dr. TM is coming back live now. He's joining us again. Hopefully the network allows him to connect. So I was saying that some people have used the fact that they say that masturbation reduces the risk of prostate cancer to they use as an excuse to masturbate regularly. Even though a lot of doctors have said that they are not sure, but then it seems and get to ejaculate regularly, they usually don't have prostate cancer. I'm not sure, but I'm hoping that a doctor on this live session will confirm that for us. So while waiting for that, just hopefully Dr. Tim is able to join us again very quickly before we run out of time. We're still trying to connect with Dr. TM, but hopefully he can join us again before we run out of time. I'll just quickly go over what he had said earlier. He has said that masturbation is, even though it was said that masturbation doesn't have any effects to our health. I mean, research says that it has little or no effect to our health. Dr. Tim has been able to establish the fact that masturbation can actually be harmful to our mental health. Just get it out, which is not the ideal thing to do. And then he has also mentioned that you could get injured because we're running out of time and we don't have so much time to go on, and we're still not able to connect with Dr. TM. We're going to quickly wrap this up, and hopefully you can watch this live session on IG Live TV, and get the information we have actually put out here, because Dr. TM has already said so much, and even if we give him more time for him to go on and expatiate on the things he has already said, for me, I feel like what he has said so far is enough for us to learn from. So this is me bringing this live session to an end, and I'm saying that I'm really glad that you joined us here today for this live session, and I hope you have learned just as much as I have learned from this live session, and I'm hoping to see you again next week, because we'll be having another exciting topic to discuss with you. Okay, yes. Thank you so much, Dr. Health and More. She has answered my question. I'm very happy about this. She is a medical doctor too, and she's saying that the prostate cancer reduction is not well understood. That's the relationship between irregular ejaculation and reducing the risk of prostate cancer is not well understood. So this is saying that this is not an excuse for you to ejaculate regularly, because it has not been confirmed if really regular ejaculation, whether through regular sex or masturbation, actually really reduces the rate of prostate cancer. Thank you so much, Dr. Health. I really appreciate this answer, that it came in timely before we actually brought this live session to an end. So I'm still trying to connect with Dr. TM for him to give us his final words before we go. So hopefully he's able to connect with us. But if he's not able to connect with us, thank you so much again for being here with us. This is First MedTrade. Okay, yes.
Sorry, I think the network is really bad. I don't know if it's my
end or your end.
Is it your end or my end?
I don't know, but I've been online, but you haven't been online, and it was difficult to connect with you.
Oh, okay. So can you hear me very well now?
Yes, I can hear you, and I would like you to give your final words, because we have a few minutes before this session ends.
Oh, okay. Sorry, I was saying that some people masturbate masturbate. They have pornography or a phone in their hands before they masturbate, and so it's easy for you to treat such addictions. All you have to do is to cut off the connection or the association of masturbation with pornography. It's easy for you to treat them. I was talking about we talked about injuries, right? The injuries that can result from masturbation, penile fracture, vaginal infections, vaginal injuries, injuries to the bladder, inserting different types of objects into the vagina, and then the premature ejaculation I talked about, leaving the partner unsatisfied. these are the harmful effects of masturbation. Let's not forget that there's also risk of hypertension, like we talked about, stroke, because when you are hypertensive, you're also at risk of having a stroke. So these are the harmful effects that one can have from masturbation. And then when it becomes excessive, addiction to masturbation is not very, very easy to treat or easy to manage, because it's a sweet feeling. It's easier to treat addiction to alcohol, but masturbation is not so easy to treat addiction to masturbation. I think those are my final words. Sorry about the network issues. Sorry about that.
No, it's totally understandable. I mean, it happens every now and then. So, and it's something we're already used to as citizens of Nigeria. Okay, thank you so much, Dr. TM. I'm so glad you were able to make it today to come and talk to us about masturbation. I mean, you already have this particular session on your Instagram page at Dr. TM, The Medical Truth, and then you did it again with us here on our platform. Really appreciate your time, your effort, and always commenting on our posts. You're always there. Thank you so much, and we look forward to having you again. Thank you.
No problem. That's fine. Thank you for having me too. Thank you for the opportunity. Thank you so much.
Thank you. Okay, see you some other time, Dr. TM. Thank you so much. Thank you. Thank you. Thank you. Thank you. Guys, this is the end of our session, so that Instagram will not log us out. I mean, they've given us a time frame, so let's run away before they actually evict us. Thank you so much for coming on our live. And yes, to know more about us, about First MedTrade Africa, log on to our website at www.firstmedtrade.com. And then you can see everything about us, find hospitals, find doctors, buy your medical consumables, book for your medical travels. That includes ground ambulance, air ambulances, commercial and private. We have you all covered. So see you same time next week Sunday with another doctor and another exciting topic. Thank you so much. Thank you, thank you, thank you. Come and carry your video.